Dr. Park, thank you so much for making time to chat with us and share a little bit of your expertise and your work in the harm reduction field.
Thank you for having me today.
Could you start by telling us a little bit about your background and your work?
Yes, I'm an epidemiologist and assistant professor of medicine at Brown University currently. My lab, the Harm Reduction Innovation Lab, focuses specifically on innovative interventions to reduce overdose. And we primarily work in Rhode Island, although I have collaborations in Maryland and a number of other states. I've been involved with the model fentanyl test strip and drug checking law, as well as research on the drug supply, fentanyl test strips, drug checking program implementation, and just excited to answer your questions and to share my insights.
So you were involved in the drafting of the model law. Why was that model law needed?
The implementation side has been moving along and the science has caught up, but the legal aspects really do come up time and time again. We conducted a survey, an online survey of organizations that had implemented. The top three barriers were funding and the legal barriers. I think that this is something that needs to be addressed in order for implementation to run smoothly and for us to really save lives.
What were some of those legal questions or concerns that a model law needed to address?
In this world, there is really a need to understand what types of equipment are allowed, and then all of the additional supplies that are needed to conduct testing. For example, the packaging that a sample comes in, the various tools that might be needed to handle those products, whether those residual samples can be transported, whether they can be mailed. A lot of these questions have come up, and so I think this type of model law can help address some of those challenges.
So sometimes you hear people really focusing on fentanyl test strips. And then more recently, I've heard a lot of people use the word drug checking. Can you talk to us about why that broader term of drug checking has become an important term?
Yes, definitely. So fentanyl test strips, I think, became mainstream partly because of the research focus on the fentanyl epidemic, but it's become very clear that fentanyl isn't the only problem. Xylazine is a really recent example of why just focusing on fentanyl alone probably won't help us in the long run. So xylazine is a veterinary medication that has been found in fentanyl and heroin samples, other drugs, and detecting something that's so new to the market or suddenly so prevalent is very important to minimize the risks associated with exposure. If we only focus on one drug, fentanyl, and by the way, the fentanyl test strip cannot detect all types of fentanyl. There are over 50 types of fentanyl out there. Fentanyl, the base compound, is one, but there are many analogs. So these are compounds that are related chemically to the original fentanyl, but vary in degrees of potency. You might have heard of carfentanil, and that is the most potent or the strongest type of fentanyl that we know of. And it has been involved in a few, relatively few, but several hundred cases across the US. And that also comes from the veterinary world. And my team's research, which was published earlier this year, showed that the fentanyl test strips, the brand that is being used the most, is actually not able to detect carfentanil at low levels. So this is another example of the gap when it comes to just focusing on one type of drug checking. There is a large intersection between these fentanyl test strip and drug checking laws and existing drug paraphernalia and possession laws. And so states really need to examine what types of laws are already on the books and see if introducing a new law would help or confuse the situation. So there's language in there that states can adopt, that will help them amend existing laws. There is actually one state, the state of Alaska, that doesn't have any drug paraphernalia laws on the books. There's also one state that does not criminalize personal drug possession, or simple drug possession, it's called. And that is also an option. And I think that there is a movement to try to shift our thinking from treating substance use as a criminal justice issue versus a public health issue. And I think that there is definitely an argument to be made that a lot of these laws that have been on the books for over 50 years are really causing a lot of harm and increasing the risk of overdose in vulnerable communities. And there's a lot of literature out there on that. But just to say that when implementing these types of laws, we do need to pay attention to the legal landscape within that state when it comes to drug paraphernalia and simple possession.
You mentioned the laws were one of the top 3 implementation challenges. I wanted to give you a chance to speak to the other 2 implementation challenges that really rose to the top.
Yes, so funding, and the second one was staffing. And funding and staffing really go hand in hand, because a lot of staff who work for health departments and community organizations also help write the grants. But federally, there has been a real reluctance to fully fund preventative harm reduction interventions. And some would argue that this reluctance has only fueled and driven overdose rates that we currently see. And so to turn the tide against this, there have been recent efforts made by SAMHSA and the CDC to provide funding for fentanyl test strips and other drug checking programs. There are over 16 drug checking programs that I know of across the US operating right now, and many of them are funded through research, through pilot grants, through foundations. But what I think that the federal government and states could really consider investing in these types of programs. And there's already a precedent for investing in what we broadly call drug surveillance. And a lot of information that we have about the drug epidemic comes from government-funded sources. So, for example, drug seizure data from the criminal justice system, or vital statistics data, EMS, emergency services data on non-fatal overdoses. These are all funded through states and the federal government. And so we would say that a drug checking stream of data could really complement these existing forms. And lastly, the other reason to fund a drug checking program in your state is the information generated by drug checking programs can be delivered at point of care to patients who need that information. The data sources that I mentioned, either drug seizures or vital statistics, unfortunately, that information isn't designed to be communicated back to patients and people who need that information. And oftentimes, especially data coming from the criminal justice end, is not available to inform public health and local needs. Often you'll see them aggregated at the state level and disseminated through reports that way. But having that local information, so for example, if I set up a drug checking program in my city of Providence, that information can benefit that local community. And now that information may look very different if I set up the same program in Woonsocket in the same state, but 20 minutes away. I think there's a lot of potential, but there are significant costs when it comes to running these programs. I would estimate that an average program that uses FTIR and fentanyl test strips will cost anywhere between $50,000 to $100,000 a year.
Have you heard of any communities thinking about using their opioid abatement funds for this type of program?
Yes, there are states that are considering it. I think it's a really great idea only because there aren't that many existing funding streams to support this work. Certainly in Rhode Island, those conversations are happening. But at the same time, I think a lot of stakeholders and community members aren't even aware that a drug checking program is a possibility just because it doesn't exist yet.
When you look at the last 3 years, for example, and you look at the legal landscape, how do you summarize what you've seen in the last 3 years and how things have changed? And why do you think it's changed? To what do you credit the changes that you observe?
Yeah, I think we have a patchwork of laws, and there has been a lot of federal inaction. And so states have really taken charge and set their own priorities. And the administration has changed from the previous administration to the current administration. There have definitely been more opportunities for even having these conversations. But I think states have a really important role, and already each state has a different set of paraphernalia and possession laws. So naturally, I think we're going to see some states really moving ahead. And we actually have already seen a couple of states, including Rhode Island and Maryland, include drug checking as paraphernalia that is allowable. So that already exists. I also mentioned Alaska as a state that actually doesn't ban any sort of paraphernalia distribution or possession. And the reasons why I think some states have been moving with more urgency is partly because of the number of overdoses. So overdoses aren't evenly distributed across the country. And so the Northeast really was hit with fentanyl much earlier on than other parts of the country. And that's where a lot of research also happened to be happening. So that I think helped further the conversation.
Is there anything that you'd like to highlight as we close out this conversation?
I would like to highlight that this work is not easy. These community organizations are facing overdose death every day. They're losing their colleagues, they're losing their family and friends. And so this model law, although there are many aspects of it that need to be worked out depending on your location, it's really important. A lot of these staff that work in these agencies are putting their own lives and livelihoods at risk just because of the nature of our current drug laws. And so I think it's our duty actually to do what we can as a society to support these community workers who are doing the really hard work day in and day out. I just have a lot of respect for their work, their hard work, their dedication. And so I do hope that states, even states that don't have a raging fentanyl epidemic or don't have an issue with xylazine, that they do consider these types of programs and model laws. I didn't really talk, because my research focuses on opioids, I didn't really talk about the recreational drug use space. So festivals, nightclubs, raves, a lot of young people are also using or trying substances on a daily basis. And these programs also can really benefit those communities. And just the goal really is to keep people safe and stop them from dying. So that's how I would like to end my talk. And I'd also say that if states are interested and have questions, they can always reach out to me and many other researchers in this space who can provide more information as well.
I really appreciate you putting the human element on this important topic. Thank you so much for your time.
Thank you for having me.